Welcome, everybody, to Benzinga's All Access show. We are here on Friday, the 17th of June, getting ready to give you exclusive access to the public companies that we work with and give you insights into what they're working on. A couple of things before we get started. As always, we want to mention our sponsor, Ticker, who gives stock perks to individual retail investors for the companies that they invest in. You can get involved with Ticker in the link in the description below. But we also have a promo video to play for Ticker before we get started. Perfect. Thank you, Aaron. All right, we've got that done. You can visit ticker.com/Benzinga to get involved with Ticker anytime. A couple of other things to mention before we get started with our first guest on All Access. Something we're going to talk a little bit more about later today, but we are going to start an exclusive giveaway program on Benzinga All Access every Friday. We'll be giving away $150 per week to one subscriber and one viewer of the All Access show. We'll talk about this more at our content gap coming up in the show, but it's a giveaway that we're going to do every week. All you have to do is subscribe, fill out a contact form. You'll be entered to win $150. We're going to do this every Friday. Every morning, one person is going to win $150. A couple of other exciting things to tease. All Access is getting some big improvements. Aaron and all the rest of the show's crew have been working hard. The show is going to get much more interesting. It's going to have a lot more exciting elements coming up. But that being said, we're going to move into our first interview and our first company of the day. We're going to bring on Shai Novik, the executive chairman of LiveX, and get All Access started. Shai, thank you for joining us. How are you?
Hey, all right. Good morning. How are you doing?
We're doing great. Very exciting to have you on. Welcome. You were the first guest of All Access today. A lot of exciting stuff to talk about. As far as I know, unless I'm mistaken, this is your first time on the All Access show. So we're excited to dive in. Again, this is the show where we really get some exclusive access to what you're working on as a public company, what your main priorities are, what your goals are, what you guys are doing in the market, and why retail investors should be paying attention. So with that being said, let's dive in. Can you give us an overview of LiveX? What is the company? What do you guys do?
All right. Thank you for the opportunity to take the time to go through on LiveX. And LiveX is quite a unique company in the sense that it is a cell therapy company, and kind of by definition, as you know, cell therapy kind of has been in existence because normal therapies, small molecules, monoclonal antibodies, just the regular drugs that we are all taking for various diseases, reached somewhat of a glass ceiling in trying to treat what we call complicated multifactorial diseases. So it became very difficult to cure some patients from their complicated diseases, and so cell therapy has kind of emerged about 10 years ago as the latest frontier of innovation that may allow to save some patients' lives. And so this revolution that started with companies that maybe some of the viewers remember, Kite Pharmaceuticals, Juno. I'm taking us back to 2014, companies that have kind of suddenly brought cell therapies for cancer patients that had an average of 12 months to live. And they started treating them with these cell therapies, and suddenly you have still patients that are still being treated today, 8 years later. So it really provided a revolution for the ability to keep patients alive and save lives. And so this was the first generation of companies. Everything was surrounding one immune cell that would be modulated, called the T cell, which is a killer cell of the immune system. And all of these companies created very smart solutions in which they would take blood from the patient, they would isolate from that blood T cells of that patient's immune system, engineer them and activate them outside of the body in some laboratory, multiply them and reinfuse them into the patient, basically providing the patient's immune system with a new army of T cells to find cancer cells and destroy them. So that was the first generation. And while it was incredibly effective, it became known that would be effective only on about 10% of cancers called blood cancers, while on the other 90% of cancers, solid tumors, like tumors unfortunately, in the liver, in the lungs, in the colon, it really had no effect. So new companies have emerged trying to figure out what would it take, what type of cell therapies would it take to take it to the next stage, to try and get some real results in patients that don't have blood cancers, that's already been kind of relatively solved, but solid tumors. So new innovations came along and new companies came along that are trying to modulate other immune system cells aside from the famous T cell. Because as I always say, if our immune system would have solved every problem by just deploying T cells, then our immune system would just have T cells. But it doesn't. It has other types of cells. And the question is, why are these cells there? And the answer is they probably have some role. So new and exciting companies came along. In this group, I can name other really great companies like Fate Therapeutics with a ticker of Fate, and Nkarta, NKTX, and others that have really taken it to the next stage of trying to modulate other immune cell systems, and so far had nice successes. Early stage, but very nice successes. And LiveX is exactly in this category of companies. What we do is quite unique. We are modulating another immune cell called the macrophage. Now, macrophages are involved in, they're like a very inherent part of our immune system, and they are typically the first responder to every immune challenge that we have in the system. And they have a bunch of evolutionary roles in helping to modulate the whole immune system response to various threats, whether it's pathogenic threats or cancer cells. So what LiveX is doing is really focusing on diseases in which macrophages are being negatively reprogrammed by the disease, and they're not functioning as well as you would expect them. Because in a healthy system, what you see macrophages responding well and helping the immune system get rid of the problem. But in some diseases, those same macrophages are supposed to help you are being actually negatively affected by the disease, and they get out of their what we call homeostatic state. And when that happens, then macrophages, not only that they don't help the immune system get rid of the disease, they actually make the disease even worse. So what LiveX has is a cell therapy that knows how to modulate macrophages. That's our claim to fame. It's a totally differentiated value proposition from every other company in the pharmaceutical industry that you know. And it's just a totally different approach. And so far, we have had very nice early on success with primarily two diseases that we are targeting. The first one that we are targeting is sepsis, which is one of the leading causes of mortality in the Western world. Pre-pandemic, it was the third leading cause of mortality. 1 in every 3 people that died in a US hospital died from sepsis. And sepsis still, after 40 years of trying to find different medications, there is no single FDA-approved therapy for sepsis. And we are going after regulation of macrophages who are very tight into sepsis. And we had a first study that was highly successful that I can talk about in a moment. And we are now in the midst of a phase 2. And we're also going after solid tumor indications, as we mentioned. We had fantastic preclinical results, which I can share momentarily. And we are now scheduled to begin 2 clinical trials this year.
Fantastic. Okay, good intro. You've teased a couple of things there. We'll dive into all of the things that you just mentioned in a moment. The first thing I want to ask about is the current drug pipeline. Anything you guys have coming up that you're excited about that you think is going to have impact? What does the drug pipeline look like for you guys? What are you currently in development on?
So we have basically one drug, which is our cell therapy, which essentially it's an infusion bag with cells, right? So that's what we do, but the purpose of these cells is to get engulfed by macrophages in your immune system. And when our cells get engulfed by macrophages in our immune system, they bring those macrophages back to their homeostatic state, to their equilibrium state. And thereby, these macrophages, now they're back in their homeostatic state. They were outside of their homeostatic state. Now they go back into proper orchestration of immune activity against the challenge at hand, whether it's the challenge is pathogenic or whether the challenge is cancer. So the pipeline for us is the same product that we developed clinically for two different indications. One is sepsis, and we are currently in a phase 2 sepsis, which is scheduled to complete next year. And the other one is in solid tumor, advanced stage solid tumor patients with that have had that received various therapies that today are available for solid tumors, but are not responding well, or the disease is still progressing, and there is not much you can give them. So we are going to give our drug product to these patients, sometimes in combination with chemotherapy, sometimes in combination with what's called the immune checkpoints. And hopefully, if we see the same results that we saw preclinically, we could be one of those companies like the old grandfathers of our industry, Kite and Juno, to really make a difference for the first time for these solid tumor patients that today have nothing. They really don't have too many good alternatives.
Got it. Okay, so when you're looking at the drug pipeline, right? Well, what's important for you when you look at the consumer segment that you serve and the drugs that you're developing for your consumers? What's really important about what the problems you guys are solving, right? You talked about this in your intro when you talked about the company, but what's the potential impact on the lives of the people that you guys are serving, right? What problems are you going to solve for them?
Right. So essentially, what we're doing is relatively brave for a small company. We're going after sepsis, which I think every year kills about close to 300,000 people in the U.S. and about another 150 or so in Europe, and then there's the rest of the world. And there is really nothing anyone can do. So when a patient arrives to the hospital with sepsis, and sepsis basically means failing organs. Okay, so sepsis is the name of the disease, but the manifestation is that these patients have one or more failing organs. Like in the clinical trial that we ran, the first one, we treated patients that had, each of our patients had between 2 to 5 organ failures upon arrival to the ICU. And they've kind of been deteriorating. And basically, when these patients get to the hospital, they don't have a lot going for them. Essentially, they're giving them fluids, they're giving them blood pressure medications, antibiotics, but there's not much they can give to prevent this negative pathway of organ failure. And all the patients that we treated, 100% of them, had complete restoration of organ activity, of all their organs, and all of them have been released healthy from the hospital, which is really unheard of for sepsis. And the control group that we looked at had 27% mortality after 28 days, and even those that didn't die, about half of those that didn't die still had organ failure on day 28, which basically means that they had still, very problematic stage, and they could die later on. And by the way, many of them did die by day 90 in the control group. So basically, this is, I think, the message that we're bringing of saying, to these patients that they had nothing. I know it's kind of weird that I'm saying that, but because there's always something, but it's true for most diseases. If you look at the number of diseases today in the world that you have nothing, that you have no FDA approved drug, these are very small, right? Now, when we move to the oncology side, it's not that there are no drugs. There are plenty of drugs. that are being administered. But the problem is this glass ceiling that we talked about. So for many of those solid tumors, the average survival of these patients across multiple solid tumor indications, for many of them, it's 20% survival, 20%. So some patients respond well to these drugs, but some really don't. And so this is where I think what we're trying to do is to say, listen, it's time to look differently, right? It's time to use new tools, new views, new modalities to really help crack this and get to much higher levels of survival for those patients. So that's basically what we're fighting for.
Got it. Okay, terrific. You just talked about a couple of different things, like I said again in your intro, the recent trials that you had and everything else. Can you share some more insights into there? What happened and why is it so significant?
So when you're looking at trying to understand the profile of the drug that you're developing, you're typically looking at some early signs for both the safety and tolerability of the drugs, right? And then you're also trying to look for early indications of efficacy. And so we were very encouraged by both the safety profile, which was tremendous, and also with the efficacy, which, as I described before, was quite phenomenal for patients that are come to the hospital in such a difficult condition. And when we look at and we spent 2021. We spent it mostly while our some of the clinical trials are running. We actually spent the time working in preclinical models in oncology to try to understand kind of the landscape of can we combine our therapy with traditional anti-cancer therapies? Do we see any synergies? Is this all appear to be safe and so forth? So just as an example, we entered into research collaboration with the Yale Cancer Center, up in New Haven, and basically what we tried over there, they ran a model which is an ovarian cancer model, which is, as you know, ovarian cancer is one of the more difficult cancers to treat, and one of the drugs that typically had failure historically in treating women with ovarian cancer is a very famous drug, which is highly effective in melanoma, called anti-PD-1 and an immune checkpoint. And what the Yale team found was that while this anti-PD-1 had very low response as a standalone, when it was combined with our drug product, instead of having all the mice die very quickly, we saved 50% of the mice, 50% versus 0. So that was ovarian cancer. In other studies that we ran internally, we looked at another very difficult cancer called mesothelioma, which is something that is the likelihood of survival is very low. There are 2 approved FDA drugs. One of them is the same one, the anti-PD-1. Another one is an anti-CTLA-4, but their efficacy is very low. So we looked at one of those FDA-approved drugs, this anti-CTLA-4, is standalone, and it had a little bit of efficacy, saved about 25% of the mice, something like that. But I want to show a slide, if I can, slide 31, in our investor presentation, just kind of showing what happens when you combine our drug with an FDA-approved drug that works just a little bit. What happens? How do you enhance it when you combine it with Allocetra? So you see this. There are 5 different groups of mice, as you can see. On the left side, you see the one that just had the cancer, this mesothelioma cancer. And you can see that as the days go by, you can see the blue, by the way, is the spread of the cancer inside the mouse. So you can see that the cancer spreads and then they all die. Okay, and then all the mice die. Then you move to the right, you can see the FDA-approved drug. What happens when you administer that? And you can see that the cancer grows a little slower, and then at the end of the day, about 25% of the mice actually survive, which is something which is incredible, right? And then you have our own drug, Biosystems, also provides on a standalone basis kind of the same effect as the FDA-approved drug, about 25, a little more percent of these mice survive. But then on the two right-handed columns, you see something fascinating. You see what happens when you combine the two. Okay, on the fourth column, you see what happens when you combine it with a low dose of our drug, and on the right-hand column, what happens when you combine it with a high dose of our drug. Now let's just take a look at that. You see what happens. In this particular study, you can see all the mice are cleared of cancer, are cleared of their mesothelioma, and survive, which is just really incredible, okay? Which is just really incredible. So we can take that slide off. So I think that remember, this is the same drug that we have infused to patients. We actually were also asked by the Ministry of Health here to treat in the midst of the COVID madhouse that was all over the world at the beginning of COVID. We also were asked to treat some patients with COVID that had lung failure because there is a lot of involvement of macrophages in these lung failures as well. And we treated 21 patients. 11 of them were in severe case of COVID and lung failing, and 10 were in critical condition. And we treated all 21, and 19 of these 21 recovered and went home, were released from the hospital after an average of 5.5 days. So basically, not that we're pursuing COVID as an indication, but this was a good for us to take a look and again to see that the product is safe, that the proposed mechanism of action of getting those failing organs back to their normal operation. Actually, it does look like it's working quite well. So we're going to be dedicating the rest of 2022 we're planning to start 2 clinical trials in advanced stage solid tumor patients that have no other solutions. We're going to treat the first group in combination with chemotherapy in the hope that we will see the same synergistic effect of our drug with chemotherapy. And the second one will be, again, advanced stage solid tumor patients that are not responding well to anti-PD-1 therapy in combination with our drug product. And these trials will continue through 2022 and 2023. So I think that we should start getting in 23, we should start getting answers whether we are able to replicate what we saw in the mice, able to replicate that in humans as we did in sepsis. In sepsis, we first saw this amazing effect in mice. We did a clinical trial in humans and it was replicated. So this is kind of while the market is really, at all-time low and biotech sector is really hurting and so forth, I think that people kind of forget that at the end of the day, as I think you very eloquently stated it, there are sick people that are dying, they have no therapies, and there are some companies that are trying to go just for that. So this is, and LiveX is one of them. We have right now a cash that should last us without raising additional financing through the end of the third quarter 2024. So hopefully during this time frame, we should be able to get the various data from our clinical trials and move on forward in an attempt to get regulatory approvals for the various indications.
That's amazing. Shai, one of the last questions I usually ask is the plans for the rest of 2022, but you just summed that up for us and gave it to us.
I apologize that I jumped ahead of time.
Never. It's very, very, very interesting. A lot of exciting things coming up for you guys. Thank you for sharing all of the information. Shai Novik from LiveX, thank you so much for joining us this morning.
Thank you so much for having me on your show.
Absolute pleasure. Shai Novik, he is the CEO of LiveX, the first guest on All Access this morning. We're actually perfect on time so far. We're going to keep things rolling and move right into our next guest, John Spurzl from T2 Biosystems. We're going to bring him on now. John, how you doing?
I'm doing great. It's great to be with you on the show today.
Good to be with you too. I do feel bad that I didn't wear a tie now because you came fully decked out to the nines, looking good. Great to have you join us this morning. Very excited to have you on. Brief intro to start. Can you tell us about T2 Biosystems, who you are, what the company does, and a little bit of background there?
We are a Nasdaq listed company, so I'll just start with our safe harbor statement, which can be found in the investor relations section of the company's website, and remind the audience that this presentation or discussion may contain some forward-looking statements and actual results may differ from those statements. T2 Biosystems is a commercial stage diagnostic company, and we are a leader in the rapid detection of sepsis causing pathogens and antibiotic resistance genes. For those that are unfamiliar with sepsis, it's the body's overwhelming and often life-threatening response to an infection. It is the #1 cause of death in U.S. hospitals, claiming the lives of approximately 270,000 people each year. It is the #1 cost of U.S. hospitalization, costing our healthcare system approximately $62 billion a year. And finally, it's the #1 cause of rehospitalization in the United States, causing about 20% of sepsis survivors to be rehospitalized within 30 days and 40% of survivors to be hospitalized within 90 days. And I have personal experience. I am a sepsis survivor following a heart transplant that I received in 2017. Back to T2 Biosystems, we have the only FDA-cleared products able to detect sepsis-causing pathogens directly from blood, and we do that in just 3 to 5 hours. We also have a very strong product pipeline, which I'm sure we'll talk about later in the discussion. And all other products, competing products, if you will, used to detect sepsis-causing pathogens continue to rely on a positive blood culture, which really has 2 notable deficiencies. The first is that blood culture is slow. It takes 1 to 5 days to achieve the growth necessary for pathogen identification. And 2, blood culture may miss infections due to its poor inherent sensitivity. And so our direct from blood, or culture independent, if you will, products are a remarkable innovation, as they allow clinicians to rapidly identify sepsis-causing pathogens and administer faster, targeted antibiotic or antifungal treatment. And identifying these sepsis-causing pathogens and treating them appropriately with targeted therapy is a race against time. Data shows that the risk of death increases by up to 8% for each hour of delayed targeted antimicrobial treatment. And I'll just close with, data was recently published in a peer-reviewed medical journal, Expert Review of Medical Devices. It analyzed 14 controlled studies that compared our technology against the blood culture-based standard of care, and the use of our products resulted in significant improvements. Faster time to species identification by 77 hours. Faster time to administer targeted antimicrobial therapy by 42 hours. Remember, for each hour of delayed targeted treatment, the risk of death goes up by up to 8%. And then finally, decreased length of patient stay in the ICU and hospital by approximately 5 days.
Fantastic. Okay, so you actually teased it a little bit right there, but that's the first thing I want to talk about is the drug pipeline. What you guys already have on the market, obviously very, very important, but what's next coming down for the company? What are some developments that you're working on for the pipe down the road?
Well, we think our products are life-saving and cost-saving, and not just save patients' life, but save their quality of life by identifying these pathogens and treating them fast. We have a really exciting new product development pipeline. It's being developed under a milestone-based product development contract with the U.S. government, or BARDA, that provides our company with up to $69 million in funding. And we have 4 products there. First, the T2 Resistance Panel. It is a direct from blood test that runs on our FDA-cleared T2Dx instrument and simultaneously detects 13 antibiotic-resistant genes in just 3 to 5 hours. We initiated a U.S. clinical trial in December of 2021, which we expect to complete this year, opening the door for filing of an FDA submission as early as this year. And importantly on this product, the FDA previously granted the T2 Resistance Panel with breakthrough device designation, which provides for a prioritized FDA review process. So that's our first product. Our second product is the T2 BioThreat panel. This is a direct from blood test like our others that runs on the FDA cleared T2Dx instrument and simultaneously detects 6 biothreat pathogens identified as threats by the US government, again, in 6 hours. It will be the first ever multi-target direct from blood bioterrorism diagnostic product. We initiated a US clinical trial also in December of 2021 for this product, which we expect to complete this year, potentially enabling a filing of an FDA submission before the end of the year. Our next two products are really exciting. First is a comprehensive panel for the detection of bloodstream infections and antimicrobial resistance. It's a direct from blood test panel designed to run on a next generation instrument. And here's the real beauty of it: to detect greater than 95% of all bloodstream infections caused by bacterial and candida pathogens, as well as all antibiotic resistant markers identified as threats by the CDC in a single test with a time to result of approximately 3 hours. So think of it as taking our current bacteria panel, fungal panel, and resistance panel, combining them into one test and dramatically expanding the ability to detect pathogens and resistance genes such that we'll detect almost all of them, 95%. And then finally, it will run on our next generation instrument, which we're leveraging the technology in our current instrument. It'll be fully automated, on demand, random access, and run multiple tests at the same time. We refer to these final two products internally as the blood culture killer, because we believe it will become the new standard of care, replacing most blood cultures for patients at risk of sepsis. And then just finally, under our US government contract with BARDA, the $69 million contract that I referenced before, we have received approximately $23 million in product development funding to date through March of 2022, or the first quarter. And we anticipate receiving approximately $46 million in additional funding between April of 2022 and the end of 2024, assuming all contracts options are exercised.
Terrific. Okay, and something else aside from the drug pipeline that I want to get some more context on is the press release about the Nasdaq extension you just received to comply with the bid price rule. Something I don't fully understand, but something we'd like to get some more context on. Why is this so impactful? Why does it matter for the company?
Well, as you mentioned, last week we announced that the company was granted an extension to regain compliance with Nasdaq's minimum bid price requirement. That extension runs until November 1st of 2022. And the company also requested to transfer its listing of common stock from the Nasdaq Global Market to the Nasdaq Capital Market tier. That was also approved and took effect on June 13th, 2022. This is impactful as we believe our listing on Nasdaq Exchange is important, one, to provide liquidity to our stockholders, two, to attract and retain talented employees within the company, and then final, enabling flexibility and addressing future capital needs. During this extension period between now and November 1st, we plan to increase share price organically by executing on our business plan, which we believe includes a number of potentially impactful catalysts over the course of 2022.
Perfect. Okay, so now that we know that, I also want to talk about the patent you announced back in May for the direct detection of Lyme disease. I think you referenced this a little bit earlier, but I want to get some more color around this too. Why is that so important, and what's been the follow-up since you announced that patent in May? Is there more development coming out on this? Are you working on it currently? What's coming next for that?
Well, the one you mentioned is covering our Lyme disease panel, which we call T2 Lyme panel. And for those that aren't aware, Lyme disease is a debilitating disease transmitted to humans through the bite of an infected tick. It's estimated that approximately 476,000 people are treated for Lyme disease each year in the United States alone. And typical symptoms feel a little bit like flu: fever, headache, fatigue, also skin rash sometimes, not always. And if left untreated or undiagnosed, infection can spread to joints, heart, nervous system, and really become debilitating. So we filed for a patent. We were granted that patent, which covers the T2 Lyme panel. It brings our patent portfolio to 47 US issued patents, 16 US patent applications, as well as 73 international patents and patent applications. And we believe this illustrates, one, the strength of our technology to rapidly identify a range of pathogens, all directly from whole blood. And it also demonstrates our commitment to advance the development and commercialization of innovative diagnostic products to address critical unmet needs. So we developed this T2 Lyme panel with substantial funding from Canon. It is a direct from blood test panel that runs on our FDA cleared T2Dx instrument and identifies the bacteria that cause Lyme disease. This is really important. Currently, there are no FDA cleared diagnostic tests for the sensitive detection of early Lyme disease. And just like sepsis, diagnosing early and getting the patient on targeted therapy is really critical to improving outcomes. And we believe our T2 Lyme panel could be a game changer as it demonstrated substantial improvement in clinical sensitivity compared to the current CDC recommended 2-tier test. And then just finally, we recently applied for breakthrough device designation with the FDA for the T2 Lyme panel. Again, I mentioned it's something that we received for our T2 resistance panel, and we're actively in dialogue with the FDA regarding that application. Next steps on T2 Lyme are ongoing. That includes pursuing external funding to continue to advance that product, as well as potential commercial partnerships.
Perfect. Okay, all great context. A couple of other things I want to dive into here. As you talk about new customer acquisition, right, where you are in the diagnostics market, how do you approach new customers? What's your sales strategy? Is it relationships? Is it direct outreach? How are you guys finding new business in the market that you're in?
So our go-to-market strategy in the US includes a direct sales force of 20 sales territories. Our products are sold exclusively to hospitals, of which there are approximately 6,000, give or take, in the United States. And our call points include the hospital laboratory, which is generally responsible for hospital-based diagnostic testing, as well as specific departments, including intensive care units where most septic patients end up, but also oncology and transplant units in larger hospitals, because those patients have generally undergone surgery, are very sick, are undergoing chemotherapy, or are immunocompromised, which makes them at greater risk to bloodstream infections and sepsis. Outside of the US, our go-to-market strategy includes a small team that manages a network of distributors. Think of them as a single distributor that has exclusive rights to a certain territory and also has specific commitments to sell, for example, a certain amount of our products. And we're currently selling our products in countries within Europe, the Middle East, Southeast Asia, and Latin America. And we plan to further expand our international distribution network in 2022 and beyond.
Perfect. Okay, another thing I want to talk about is the recent earnings report as well for Q1, right? A lot of what you talked about in there was pointing to the decreased COVID testing being a primary factor and the product revenue being 17% lower year over year. Do you think this is a trend that's going to continue? Do you think it's something that's going to taper off? And if so, how are you going to make up that shortfall moving into the rest of this year?
So our guidance for 2022 was essentially flat product revenue. And I think there's a really important nuance in that number. And it does impact or start with our COVID diagnostic test sales. It's important to remember why we developed a COVID diagnostic test. Critically ill, hospitalized COVID patients are at greater risk of developing a bloodstream infection and sepsis. So we saw COVID as a catalyst to increase the adoption of our sepsis products. This has always been about sepsis for us. In fact, we sold 47 T2Dx instruments in US hospitals, doubling our installed base in the second half of 2020 alone. Initially, those instruments were to be used for COVID testing, which they were, and we expect the majority of those instruments to transition to our sepsis panels over time. So our sales of COVID tests have generally been aligned with US hospitalization rates, because again, we're selling only to US hospitals there. And we expect that to continue in the future. Most people, most countries, most regions, most states within the United States are seeing a decline in COVID testing and COVID infections, which is great. And as accordingly, we've guided to a decrease in COVID-19 sales in 2022, which of approximately $6 million, which we expect to be made up for entirely by increased sales of our sepsis panels, including T2 bacteria, T2 Candida, and T2 resistance.
Perfect. Okay, I want to take a little bit of a broader view on that and what you just talked about with you guys specifically. But if you look at the medical diagnostics market as a whole right now in 2022, What are some of the growth drivers for the rest of this year? What are some of the inhibitors? What are some things that you think you guys are going to overcome as you move through the rest of this year?
I would point to two really important growth drivers for diagnostics. First, the pandemic has highlighted the importance of rapid and accurate diagnostics and the benefit of knowing the status of the patient before we initiate treatment. And second, consumer awareness of diagnostic testing has increased exponentially. People that knew nothing or very little about diagnostic tests pre-pandemic now know the difference between an antibody test, an antigen test, and a PCR or molecular diagnostic test. So consumer knowledge has increased, as I said, exponentially, and that kind of awareness in consumers can drive demand. And if I shift that to T2 Biosystems, we're focused on sepsis. It's the number one cost of hospitalization, the number one cause of death in US hospitalizations. And our products can play an important role in antibiotic stewardship, making sure the patient gets the right drug for the right bug, if you will, that we're treating the pathogen with targeted therapy. And it can also play an important role in addressing the threat of antibiotic resistance, which is one of the greatest threats to humanity. And we believe that those things can be significant growth drivers for T2 Biosystems.
Fantastic. Okay, so if you're talking about growth drivers as well, and this is the question we'll end on as we get close on time, but the medical devices market as a whole, purportedly it's estimated to be around 720 billion by 2029 by some estimates. If you look at this market growing over the next 5, 6, 7 years, how much of that estimated market, if it is at that size at that point, do you think T2 Biosystems can carve out?
Well, medical device market is certainly a large and growing market, and some sectors are growing faster than others. Certainly, we've seen rapid growth in infectious disease pre-pandemic and also during the pandemic. And we've seen the same thing in terms of sepsis. We believe the market opportunity for T2 Biosystems and our current product portfolio is approximately $2 billion. And as I mentioned earlier, the US market includes approximately 6,000 hospitals, and our US installed base is nearing 100 instruments and growing. So we have significant opportunity to continue that growth into the future. And we're excited about that, not just with our current products, but also with our future products.
Outstanding. Well, we're wrapping right up on time, but it's been an absolute pleasure talking with you, John Spurzl, the CEO of T2 Biosystems. It's been a pleasure. There's a lot to look forward to here. Obviously, we're excited to chat with you again soon. Thank you so much.
Thank you very much. Appreciate it.
Fantastic. T2 Biosystems, our last guest, keeping things moving still right on time, which is actually a little bit rare for us. We're going to move right into our next appearance with Shane Johnson, the Senior Vice President and General Manager of Medica, and bring him on right now. Shane, how you doing? Thanks for joining us.
Doing well. Good to see you. Thank you for having me.
Good to see you as well, Shane. Thank you so much for joining us this morning. Let's dive right in with an intro. Can you tell us a little bit about yourself and your role and a little bit about the company and what you guys do?
Sure. And actually, I'd love it if you put up just kind of an intro slide. So Medica is a wholly owned subsidiary of Inmet Pharmaceuticals. If you can, go to the next slide there. But my background is neuroscience and medicine. I'm one of the founders of Medica. We were acquired by Inmet late last year. Inmet as a whole, we are a rare cannabinoid company, and at our core, we have a strong and diverse R&D and manufacturing capability that underpins both our pharmaceutical as well as commercial programs. We believe that this combination of pharma and commercial business creates a truly unique offering to investors in the space. Specifically, we have the long-term value proposition of a pharmaceutical development program coupled with the immediate revenue of a commercial program focused on the health and wellness sector. It is important to note that since we don't touch the plant or THC, unlike a lot of cannabis adjacent companies, we can list on the Nasdaq. So Inmet is listed on the Nasdaq, and I think that that's a differentiator for potential investors. We're focused on rare cannabinoids specifically because we believe that that is where tremendous value waits to be unlocked in both, excuse me, both the health and wellness sector as well as the pharmaceutical sector. These rare cannabinoids have unique properties that are tied to specific effects, which in turn enable differentiated products. Touching on our manufacturing capability for a moment, we employ 3 distinct manufacturing approaches to make our cannabinoids. Those are biosynthesis, a process we call integrison, which is a cell-free enzymatic biotransformation, and also chemical synthesis. We're capable of scaling through these approaches to metric tons of manufacturing capacity. I also think it's worth mentioning that these approaches are nothing new in other industries. For instance, insulin and hyaluronic acid are manufactured typically through biosynthesis in yeast and bacteria, and most vitamins, such as vitamins C and D, are manufactured through chemical synthesis. So we're really just applying these modern manufacturing techniques to cannabinoids, and in our case can pick the most effective approach based on the end goal. On the pharmaceutical side of our program, our lead program is in a phase 2 clinical trials. It utilizes CBN, the rare cannabinoid CBN, for the treatment of epidermolysis bullosa, an extremely rare genetic skin disorder. We also have a preclinical program targeting glaucoma and a broader patent pending neurodegenerative program that may have applicability to diseases such as Alzheimer's and Parkinson's. In the health and wellness sector, we're focused on growing revenues through selling our expanded portfolio B2B to companies who want to access these unique compounds. Many of our customers today operate in the hemp and cannabis industries, but over time we expect to increase adoption by more mainstream consumer packaged goods companies. So I think that provides a good framework for what we're doing as a whole, and would love to take any questions that you may have for us.
Perfect. Okay, let's dive in there, right? I'm going to ask you kind of an overarching question right off the top. The stigma surrounding the cannabis industry, it's still present. It's here in our country. Anything related to cannabis, obviously still a bit of a stigma attached to it, right? How do you guys plan on addressing that stigma and eliminating it as you move forward as a company? What are your thoughts on the market as a whole and how people are going to continue to respond to it as we move forward?
Look, I mean, that's obviously a very complex question. I don't think we're going to necessarily be the only one solving that. What we bring to the table is, a very pure, consistent approach to manufacturing these cannabinoids and ultimately enabling them to be brought to market in ways that are consistent, repeatable, et cetera. I think one of the big challenges today in this industry is that it's been a Wild West. Part of that comes down to regulation. I can't directly influence regulation, but I think you're seeing, partly because of pent-up consumer demand around a lot of these, I'm speaking specifically about the commercial health and wellness sector right now. People are using CBD products every day now. One of the problems with CBD products is that they don't have consistency. This has been brought up in many headline reports. That's what we enable. We enable people to make products with a high degree of consistency where a consumer knows that they will get what they're paying for.
Perfect. Okay. Now the term rare cannabinoid, it's not often heard. It's not something that I've heard very much either. But talk a little bit more about the cannabinoid specifically. What makes the one that you guys have so special, and what are some of the potential implications of it? You referenced this a little bit earlier, but just dive in some more detail about the cannabinoid.
Sure. So most people have heard of THC and CBD. Those are 2 out of approximately 150 cannabinoids that are found in the plant. So we are focused on the remaining cannabinoids, as it were. And each of these cannabinoids has unique properties. CBD is non-intoxicating. People are finding it useful. Obviously, it's an FDA-approved drug for the treatment of seizures called Epidiolex. It's also, many people also use it for, in their daily lives for pain, anxiety, things like that. What's unique about these rare cannabinoids, and we focus specifically on non-intoxicating cannabinoids, so we don't touch THC itself. But what's unique about these rare cannabinoids is that they each have unique properties. For instance, one that we are just launching now and announced recently, Delta 9 THCV, it's implicated in huge potential opportunities around appetite suppression, hence weight loss, potential maintenance of normal blood sugar levels, things that apply to many, many of us. So I think when we talk about rare cannabinoids, we are literally talking about, opportunities to have targeted effects that impact our daily lives. We right now have we now have commercially available 4 different cannabinoids, and we've made anywhere from 20 to 30. And when I say, and these are bioidentical to what you would find in the plant, just the plant is not efficient at making them.
Got it. Okay, and I think it's a fair statement, right, to say that decades ago, people weren't really aware of the benefits and the health benefits associated with CBD, right? As you guys have grown in this industry and you've grown as a company, do you feel that you've unlocked the full potential of what CBD can do as far as health benefits, or have you guys just touched like the tip of the iceberg? Is there more to come here?
So for clarity, we're not focused on CBD itself. We're focused again on all of these rare cannabinoids that we see in many cases potentially even working synergistically with cannabinoids such as CBD. No, I think we're at the tip of the iceberg. I think that we're at the first inning. We had many decades of zero research being enabled in this field. Cannabinoids as a whole, if you look at the growing body of data, the endocannabinoid system, which I went to a fairly prominent medical school and never learned a thing about it. Now that was in the in the mid 1990s. You fast forward to today, we've come to understand, and there's great research coming out of places like Israel. But the endocannabinoid system really is implicated in helping maintain homeostasis in our body. So kind of maintenance of what is normal, kind of quote unquote, across a number of different systems in our body. That's why people talk, you've probably heard about people saying, oh, CBD does, everything. Well, I don't think CBD does everything, but can these different cannabinoids, once we learn more about them, and there's great research being done today globally, do they have potential applicability across things ranging from pain to mental health to digestive health to, again, the list goes on and on. The answer is yes. We're at the tip of the iceberg. We're trying to be a leader in that. One of the areas, for instance, we're collaborating. We're with another company to put the THCV that we're making, which is this Delta 9 bioidentical to what the plant makes THCV, into a human study to research some of those endpoints. And that's a study we announced that publicly, in collaboration with a company called Radical that is doing some of these investigations.
Fantastic. Okay, and let's talk about differentiation a little bit, right? Because on the Inmet website, it talks about many scientists being able to synthesize cannabinoids, but very few can do so at large scale when maintaining purity, quality, and consistency. Taking that into account, what do you think it is that you guys do that sets you apart from other companies in the space? What are you really excited about when it comes to how you're approaching this market?
Sure. Look, I think it just goes to our core strengths. As I mentioned earlier, we have 3 different approaches that we can take to manufacturing these cannabinoids. And in fact, we can take hybrid approaches as well. And the plant itself is very complex. I mean, the plant biosynthesizes some cannabinoids, but then chemical reactions take place. UV light or heat, touch the plant, and that causes a chemical conversion. So ultimately what we're doing is mixing and matching different manufacturing approaches. And this goes to the core strength of our R&D team, who've had, combined well over 100 years of experience with these different manufacturing approaches. But at the end of the day, we're able to select the most effective manufacturing technique or techniques, depending on what cannabinoid we're trying to make, at what scale, for what end use, and we're able to pick that manufacturing approach to match that end need. So if we want to make something at huge scale, we're currently manufacturing 200 kilogram batches of our lead, the first cannabinoid we launched, cannabichromene. We're not manufacturing the other cannabinoids we've launched yet at that scale, but we certainly have the ability to do that and are moving that direction. Some of that is matching against market demand.
Absolutely. And talk a little bit more about the Inmet relationship, right? In terms of what you guys get out of that relationship, and obviously why they're so beneficial to you. Is it from a guidance standpoint? Is it from a product standpoint? Relationships, connections, door openings. What is it that makes the relationship with Inmet so valuable?
Yeah, I actually think it's a relationship that goes both ways. It's truly synergistic. We started off the relationship as a collaboration, back in October, I think it was now October, November of 2020. We wanted to look at their integricin enzyme, based biotransformation to see if some of what they had done might have applicability to, Bay Medica's manufacturing for the commercial sector. And they in turn were very interested. We have a very strong program in making novel analogs. If you really think about the pharmaceutical aspect of this, hats off to GW Pharma and now Jazz Pharmaceuticals for bringing Epidiolex to market, which is plant-derived CBD. But at the end of the day, that is not as protectable from they don't own CBD. That's why you see CBD out there everywhere. And so we're really focused. We have a strong analog portfolio. So small variations of these naturally occurring cannabinoids, where they may have some improved physiological properties. And that's really kind of one of the areas that InMed found interesting is, hey, if we can actually have improved versions of naturally occurring cannabinoids to take through this incredibly expensive and long clinical development process, and we actually have a stronger intellectual property position at the end of the day because we can own that compound, that's a fantastic synergy as well. So the relationship goes both ways. In the near term, the parent company has been very helpful in providing us additional resources to launch more cannabinoids. We had a very aggressive program in place to launch additional cannabinoids the first half of this calendar year. And we've been doing that, executing on that. And in turn, though, that is going to enable, what we believe is longer term revenue generation and contribution back to the entire company in the form of positive cash flow.
Got it. Yeah, it makes a lot of sense. And I want to talk a little bit more about the specifics of what you do too. The biosynthesis process is actually really interesting. I was reading up a little bit about the growth, the separation, the purification. Take us through the steps that go into that biosynthesis process and how that actually comes to being from the start to the finish.
Sure. Yeah, and biosynthesis is look, it happens around us every day. A plant that is making things. So the cannabis plant, it biosynthesizes many cannabinoids, and as I said, chemical reaction take place as well. But effectively, in our case, we're using yeast that has been genetically engineered. So the yeast is genetically engineered. The end product is not GMO because the end products would be pure chemicals at that point in time, pure compounds. But you basically reprogram the yeast, feed them sugar and other put them in an environment that's healthy, and for them to grow and multiply, and literally as they grow. And the simplest way to think about it is, at the end of the day, if we have most people know that brewer's yeast is in the background behind beer. Well, in our case, if we do the fermentation right, instead of beer with alcohol, we get a broth with the yeast that has the cannabinoids of interest, or cannabinoid. Then we have to basically do a downstream purification process where we're literally extracting that out of the yeast, purifying it down, and that's what we can make and bring to market.
Got it. Okay, perfect. Now, talking about going to market, right? Let's talk a little bit about the process of getting this product out, right? Do you have a sales team in-house? Is it more of going out in relationships with suppliers that you're going through indirectly? What's the process of getting your products out there?
A little bit of both. We recently brought on a VP of sales and marketing, Jerry Griffin. That was back in February, and he's really taken the bull by the horn, so to speak, and is leading our efforts in terms of our external sales. Most of our sales today, again, we're B2B, we're really focused on points in the market where we can get leverage. So distributors, white label manufacturers, et cetera, where it's kind of one to many at this point in time. Over time, I do expect that more mainstream, especially once the regulatory landscape becomes a little bit cleaner, I think that you're going to see mainstream CPG companies get involved. In that case, obviously at that point, you're dealing with people who are, have substantial portfolios in their own right and don't do anything at small volumes. But right now, to be able to move product, we're really focused on primarily relationships where, our customers in turn have many customers.
Fantastic. Okay, and expanding on that just a little bit too, actually a question from our chat. Your reach nationally, worldwide, how extensive is your reach into the retail market and the consumers? Are you worldwide? Are you international at this point? Or are you focused on the US?
We're primarily focused on the US. We have had a couple of direct sales internationally, where whether through our outreach or in some cases inbound inquiries. I also know that a couple of the folks that we distribute to have an international effort. So I would say the international is a little bit more indirect, less of a focus right now. Over time, we will probably enhance our efforts, in that arena. But for right now, we're really focused on the U.S. opportunity, which itself is enormous.
Got it. And actually another follow-up question from there too, but your cost compared to the white label supplier compared to other companies or as the white label supplier, what's the cost difference there? Is there any differential in how you price your products compared to other companies in the space?
Um, Well, look, I think it depends on probably a little bit on the product, but we're focused on delivering super high quality products at a very fair price point. Again, like our lead compound, cannabichromene, I believe we're a price leader. I mean, we manufacture more of it, I believe, than any other company out there, and we are a leader in that market. Some of these newer cannabinoids, we're still, kind of learning about the market a little bit as we enter it, in terms of the actual pull through and demand and price points and where we get pushback. So we're modulating, but we're coming in trying to be very reasonable on the price, but also, like in the case of a Delta 9 THC, a premium product that we are able to make at scale, where if much of it, like Delta 9 THC is made by the plant, but when the plant's making a lot of Delta 9 THC, it's often making THC as well. And so that puts it squarely in the realm of marijuana, which you probably shouldn't be shipping across state lines.
Got it. Okay, and a final question also from our audience too, but let's talk about maybe the more negative side of this, but something that's also a trending topic and something that's important to discuss. But any side effects that have been associated with cannabinoids in any way? Have you guys seen any evidence of this? Anything you've discovered? Are there any side effects that are related to cannabinoid use?
Well, I mean, cannabinoids, broadly speaking, I think the answer would be yes. If you're talking about safety, they've generally proven to be extremely safe compounds. We have millennia of experience with that. In terms of side effects, well, do you want to get high? I mean, if you don't, probably don't take THC, even though THC might be useful for many people. For people have there are reports of THC being useful for the treatment of pain and nausea, and it's an FDA approved drug for the treatment of nausea and vomiting, right? So but it also gets you intoxicated. So is that a side effect or is it a desired effect? I guess I would throw the question back a little bit. But I think on the safety profile, extremely safe compounds by and large, especially relative to all of the other things that we as humans ingest voluntarily on a daily basis. I mean, Tylenol has a far worse safety profile.
Got it. No, it's great insight, and obviously it's something that we're going to talk a lot more about. Hopefully, we get to have another conversation with you about this soon. The market as a whole, where things are going, but specifically BayMedica. Best of luck to you guys. Thank you so much for joining us this morning.
Thank you so much for your time. Really appreciate it. Have a great day.
Thank you. Shane Johnson from BayMedica joining us there. Moving on to our next presentation, we're going to keep things clipping and bring on Jason Matuszewski, the CEO of Biosystems Technologies. Jason, how you doing?
Hey, good morning, Michael. Thank you for having us. Really appreciate
Always
it.
a pleasure. Yeah, always a pleasure to talk with you, Jason. You have one of the more unique last names I know of. Very impressive. I had a couple of tries getting it right, but it's great to be here. Excited to talk with you. Give us an overview of Biostem. Let's start out at a large level. What does the company do?
Sure. Biosystems Technologies, BSEM, is a leading innovator focused on harnessing the natural properties of perinatal tissue. We develop, manufacture, and commercialize allografts for the regenerative therapies. Initially, we're focused heavily in the wound care space. We have three key pillars of excellence: advanced wound care, surgical, and plastic and dermatology. And we're currently focusing on the phased approach: phase 1, phase 2, phase 3. Phase 1 is heavily focused on advanced wound care, and commercializing our product in that space.
Got it. Okay, and talk a little bit specifically about your background too, right? How you came to be with the company, what is so exciting about it that drew you to this space, and how
Yeah.
did you get started in this in the first place?
Yeah, thanks. So originally we started, myself and two other co-founders started the company in 2014. We were heavily focused on regenerative medicine from one of the co-founders' effects of regenerative medicine on a post-cancer therapy. And then pivoted in 2018 with an asset acquisition of a perinatal company, and then kind of never looked back and heavily focused on perinatal tissue products moving forward. That started with our single layer membrane product Vendage, dual layer membrane product Vendage AC, and then a single layer membrane product Vendage Optic for anywhere in the orbital space.
Got it. Okay, and you mentioned Vendage, very, very interesting product. Another name that I definitely had a couple of pronunciation issues with. But let's talk a little bit more about Vendage. What makes it so impactful? What's so special about it? And more importantly, what's the impact it could have on the audience and the consumers that you're trying to reach?
Yeah, we kind of took a different approach when we looked at ways to manufacture our product. We have competitors, MyMedics, Organogenesis, others focusing in perinatal tissue and the development of perinatal tissue for wound care specifically. And we said, let's take a look at a way to manufacture this product in a unique way. And we've identified a way, and we worked around it and developed it. It's called the bio-retain process. And that process said, we kind of looked at it, how do we maximize the growth factor output from perinatal tissue, maintaining a 361 environment, so minimally manipulated. And that's what drew us to developing the bio-retain process and maximizing the growth factor potential.
Perfect. Okay, so knowing that, let's talk a little bit about your go-to-market process, right? As you have your products and you have your pipeline and everything else, what's the product for the people that you're serving, first of all, your clients and your customers, but what's the go-to-market process from the time that you create something to the time that it gets shipped out?
Sure. It takes us roughly about anywhere between 40 to 60 days to process the tissue. Our go-to-market strategy originally, out of the gate right now, is a phase one approach, which is focusing on advanced wound care. We're looking at targeting, we received a Q code, Q4252, for our initial product Vendage, and we're looking at targeting the 8 MAC regions initially, Medicare reimbursed on the product. At the same time, we're currently working on a diabetic foot ulcer study to start looking at having commercial payers also pay and reimburse on the product.
Got it. Okay, a bigger question here, but a term that's used for obviously a lot of biotech companies, but being preclinical as a company, what exactly does that mean to be preclinical when you have that term attached to it? And more importantly, how are you going to transition after you move out of the preclinical stage as a company itself?
Yeah, ironically, just changed our company description. Originally, it was predicated around preclinical development. We are actually commercializing this product, and that's some of the successes that we've seen. 2018 is when we did the asset acquisition of these perinatal allografts, and then moved in 2019, 2020. We've had significant revenue growth around these products. Something that we highlighted in our Q1 financials in 2022 is a huge number, 212% increase year over year on distribution of these products, 2.7 million in revenue in Q1, whereas in all of 2020 we did 2.5, obviously predicated on a downturn with COVID and elective surgeries being closed, and 2019 of total of 2.6 million. So just in Q1 of 2022, we've almost eclipsed our total revenue of the last 2 years. So huge success in as far as commercializing these products. Like I said, originally, currently focused heavily on phase one approach of advanced wound care, focusing on diabetic foot ulcers, pressure ulcers, and venous ulcers, mostly in private practice settings, and the product being reimbursed through Medicare.
Got it. No, all good information. Actually, I'm glad you brought up the Q1 earnings report. That was the next place I was going to head with it. Tell us a little bit more about that revenue growth, right? I mean, you guys were up 211% year over year. It's a massive growth. What other factors would you say led to that revenue growth from last year?
A huge component to that is definitely the Q code for Vendage. We got the code approved in October of last year at 21, and then subsequently started building that sales and distribution effort around that code. So adding in sales team members, originally focused initially on distribution partners, so distributors to distribute our product, and then now heavily focused on building out a W2 sales effort to commercialize those products, Vendage. We anticipate, we have filed for additional Q codes for Vendage AC and Vendage Optic, and in anticipation of getting those codes here in Q3. So pretty excited to add additional products to the sales bag.
Got it. Okay, and then let's talk a little bit more about the anticipation for this year. When you're talking about plans for the rest of 2022, is it going to be more of a focus on product, on consumers, on selling? Where is your focus going to be for the rest of this year?
Yeah, I mean, I think right now our major focus right now is building a commercial team. We initially started with a very small team, obviously, few sales W2 representatives, mostly heavily focused on distribution and distributorships, and then also actually working as more of a private label or white label manufacturer for other brands. And then we shifted. So now we're focused on building out that W2 team, hoping to get anywhere between 10 to 20 W2 reps geographically located in the MAC regions, 8 MAC regions throughout the United States, and then hopefully see continued adoption of our Vendage product line for treatment of the diabetic foot ulcers, pressure ulcers, and venous ulcers.
Got it. Okay, and knowing the path forward for the rest of this year, I think it would be an understatement to say that the markets have been tough the last couple of months, right? Obviously, it's been a tough week. We're in a very interesting period right now, to say the least. Talk a little bit about the market as a whole, right? When you look at biotech companies, what are some of the things that are holding us up? What are some of the things that are holding us back? Some inhibitors for growth, but also some bright spots that you see as opportunities for the biotech market in 2022.
Yeah, I mean, honestly, actually, specifically for us, I think we're in a great position. I mean, I think we've left ourselves lean and mean originally coming out of 2020 and pandemic year into 21 and 2022. We've been able to get reimbursement support from Medicare on Q4252 for Vendage, and then subsequently, hopefully, getting additional Q codes for Vendage AC and Vendage Optic. I think that puts us in a unique position that, compared to others, for example, our competitors, where they have massive distribution teams, W2 sales teams, where, like you mentioned earlier, it's pretty tough for biotechs right now getting hammered in Nasdaq and other major markets, where they're looking at layoffs or looking at leaning out those teams. Where we're on the flip side, we're in major growth mode, as I say. Building a team, starting to get more and more distribution of our product. And we're really excited to see the adoption of our product based on our unique method. We feel that outcomes are going to be better in our process. And one of the things, to go back on the bioretain method, is when we looked at other competitors, we said, okay, not only how do we maximize or improve growth factor concentration, other elements inside the product, but how do we make it more efficient? How do we get our product to be manufactured in a shorter period of time? And that's kind of what led us to developing our method and really leaning out how much time it actually takes to manufacture our product over the competitors. So I think that gives us a unique advantage.
Absolutely, yeah, and of course, right. The major thing when you're talking about the markets is what's coming next, right? None of us know, none of us have a crystal ball. But I want to talk a little bit more about the earnings report too that you mentioned. Let's talk about the balance sheet, right? You talked in your press release about continuing to strengthen that, converting almost 3.4 million of liabilities to common stock. Why do you think that's impactful for the company? Why does it matter, and what's going to be important with that moving forward?
Yeah, I think it allows us to take the next step to kind of graduate up the OTC tier market, clean up that balance sheet, and then show this growth on the company on the sales side, right? I think obviously as you listen to other commentators, a strong balance sheet and a strong cash flow statement is key to getting through a recession-based market, right, or a recession-based time. And so I think for us, really focusing on cleaning up the balance sheet and then really aggressively focusing on sales and distribution are two key elements that will make us stand out compared to some of the other competitors.
Absolutely. And when you're talking about standing out with competitors too, right? We talked with an earlier guest about the potential addressable market for biotech. By 2029, moving ahead, some reports estimating around 720 billion. When you talk about this estimated market, what is your addressable market size? Where do you see the company moving in terms of revenue in the next few years?
Yeah, I mean, when I look at specifically our market, we actually had a slide that we would present. I think it was the second slide that we gave you guys. Um, just the diabetic foot ulcer market alone is roughly about 30 million patients in the U.S. And 2.9 million of those patients in chronic wounds. I think when you look at that patient population and looking at outcomes with the use of our product compared to other competitors, I think we see an ability to actually capture some of that market share. We have large competitors that own a huge amount of that market share. So address, going in and attacking and trying to find ways to kind of carve out niche areas for our product and gain some market share. Right? We're kind of the little engine that could at some point, because we are a very small percentage of that current market share. So really excited to even carve out a little percentage is a huge increase for us and our folks.
Awesome. Well, we'll see if we can pull that slide up for you in your deck in just a second here. Anything else you want to take us through on here? I know you just mentioned one of the slides. We'll see if we can scroll to that, but where do you want us to go through in here?
I think it looks like it's damaged, so I guess we'll pass on that. But
Got it.
no
Yep,
worries.
let's pull that up. No worries. Sorry about that, Jason. No worries. We'll see if we can pull that up. We'll make sure to release it later on with the full interview. But let's dive into a couple other things about the business. Let's talk about your team, right? When you look at the BioStem team, what is it about your leadership, your sales team, whoever it is that really drives the business? What's important for you guys in terms of your culture and the people that are building the business?
Yeah, I mean, I think myself as CEO, other co-founder Andrew Van Vers is COO. We started the company together in 2014 and have really driven home the family atmosphere. We wouldn't be here without everybody as a BioStem team member. Putting in hard work, dedication. Definitely through the pandemic was definitely a tough area due to the fact that our products are heavily used in elective surgeries, right? So everyone really fought tooth and nail. We're a tight knit team. Just roughly about 24 employees total, so it's a pretty small company. But without everyone's dedication, I think we wouldn't see the successes that we're seeing, obviously in Q1 and at the end of 2021 as well. So
Awesome. Makes sense. Let's talk a little bit about the financing of the company, right? Is there any plans for fundraising or raising capital later in this year? When you look at the balance sheet, obviously we already talked about converting some of that liability over to common stock. Is there any plans for fundraising later this year or raising more capital?
right now, I think we're just aggressively looking at commercializing the product. I mean, we have a decent amount of capital, cash on the balance sheet just from commercialization. We feel very strongly about just organic growth right now. We are anticipating moving up, like I said, OTC markets, moving to OTCQB, or based on revenue totals to meeting the OTCQX guidelines to OTCQX, and maintaining an alternative reporting status. Back to your point about the balance sheet, one of the things that I think is a huge litmus test for management here is of those liabilities, 1.3 million of those liabilities was back compensation to the executive management, and the executive management took common stock in lieu of getting cash. And I think that's a huge testament as to the direction of where this management team feels this company's going. We have 100% faith and dedication as to knowing where this organization is going and how quickly we can continue to commercialize our products and grow the company.
Absolutely. So differentiating the products, obviously we've already talked about Vendage, but one thing I want to focus on is what you think separates Vendage from other products in the space, right? If you look at what you guys have created and obviously what you've recently achieved with Vendage, what really makes that stand out from other companies in the space and what they're working on?
Yeah, I think the biggest differentiator is our bioretaining process. We looked at, like I mentioned earlier, I have a mechanical engineering background. I worked heavily with the scientific team to kind of come up with a unique way to look at, call it solving the puzzle in a different manner. One, creating efficiency on the manufacturing side, but also two, looking at how do we maintain or preserve all of the elements inside that tissue without disrupting it heavily, which still maintains the guidance or inside the guidance of 361 minimally manipulated tissue guidance by the FDA. So I think that's honestly the biggest differentiator. What we've found on the output side is higher growth factor concentrations, better proteins, better elements inside that tissue, as well as structural components like collagen strand structure, where those elements really actually maintain their structure based on other, call it current standard methods in which folks are processing perinatal tissue.
Got it. Okay, more of a technical question, but something that I was actually really interested in when we were doing the research for this. Talk about the local microenvironments.
Yeah.
Something that's mentioned on your website, very interesting. What exactly does that term mean, and why is it so important?
Yeah, we coined the term LMA or local microenvironment based on the fact that when we inherently place a perinatal graft in that area, the local microenvironment is that environment around which the graft is placed on and how your body interacts with that environment. So we really are trying to drive home that the fact is by placing this graft in that area, not only is the graft helping on improving closure rates of that wound, but also your body is actually creating a local microenvironment activation, or your body itself is activating the graft that's being placed on that area.
Interesting. Okay, and there's also some other terms on here too that I've obviously never heard, but that are obviously playing into what you guys are doing. The exosome signaling too. You talk about what that is and why that's so important.
I mean, I think exosomes is an interesting new craze in regenerative medicine space. I think folks there's companies trying to identify how to use that vehicle to deliver microRNA or other elements inside of the lipid. But I think what we are looking at is how those elements inside the graft, exosomes or other micro elements inside the graft actually signal and create that LMA effect, right? So using exosomes as a signaling device to activate the LMA profile.
Got it. Okay, perfect. A last question to kind of wrap up with you here on. Again, the audience that we're talking to here is retail investors, right? Individuals, not always incredibly educated on the biotech space. Some of the terms that you guys use and are frequent with every day, not something that we always interact with, right? So, if you're paring down the company to speak to an individual retail investor, what's so important about the company's growth profile in the rest of this year and moving forward past 2022 as well? What's something that you would present to any common investor?
I mean, I think the biggest factor, or what we would truly try to get across to a typical retail investor is our ability to commercialize our products and the growth rate associated with that. We're seeing, like we mentioned earlier, 212% increase year over year for Q1 of 2022. We see that profile continuing to grow quarter to quarter, year over year. It'll only possibly compound with the approval of additional Q codes. And then as well as we grow that commercial strategy with completing our diabetic foot ulcer study and getting commercial payers like the Aetnas, Humanas, et cetera, to reimburse for our products, we will only continue to see that commercialization and that revenue number continue to grow. With that revenue creates a solid, healthy balance sheet, being able to pay off remaining components of our debt, converting working with some of our other debt holders convert into equity. And I think that drives a really good growth strategy and growth story of the company. And I think from an investor's perspective, that's something that everyone's looking for, something that's stable, something that's actually growing based on increasing revenue share, and not solely focused on a pipeline or call it a long shot based on a phase 1, phase 2, phase 3 clinical approach.
Absolutely. And I know I've just watched a couple of people actually in the chat talking about how they've been watching you guys since 2016, saying these are very exciting times. They've been happy to see the growth. Jason Matuszewski, CEO of Biostem. It's been absolutely a pleasure to have you on. Thank you so much for joining us.
Thanks, Michael. Thanks for the Benzinga team for having us, and really appreciate it. First time, so hopefully many more.
First time of many, absolutely. Jason, thank you so much for joining us. Absolute pleasure. Biostem Technologies joining us on All Access. Moving into the next part of today, we have a content gap that we are going to fill with Mitchell Hotch joining us to give us a market update. I don't know if he's ready to jump on. He is. Mitch, how are we doing?
I was born ready, Michael, so I don't got to worry about that. We were
I
ready to go before we even started. So one of the
well, we
things
like
that we do is
yeah.
definitely take a look at the overall market. But before we get into that, I know that you kind of already prefaced it a little bit. We're working on a great giveaway here, right? Can you go ahead and
We do,
preface it a little
yes. We got a couple of exciting things. We're going to actually play an intro for Ticker, but before we do that, we want to talk about the giveaway that we're going to start doing. So every week on All Access, we're going to be giving away $150 at the end of each episode. So the way this is going to work is we'll have a contact form that we're going to have to fill out. Once you submit that, it's going to be a link inside the description, and subscribe to the channel. You'll be automatically registered to be one of the people that will win $150 at the end of All Access. We'll announce the winner every week. It's starting next Friday. We wanted to do it yesterday. Aaron Thomas and I worked on the form that we would have to fill out to get this rolling. We didn't get it done. I was up till about 1 a.m. last night, a little bit tired. We didn't get to it. We tried. But next Friday, we're going to be starting this every Friday, $150 given away at the end of All Access.
Yeah, something to definitely keep looking forward to. And one of the things that I always talk about, this is not only now an opportunity to catch some news stories on companies that you guys out there are definitely getting the information on, but looks now you got an opportunity to also win some money. So it seems like the right place to be. Let's go ahead. I'm going to dive on into the market. I'm going to give you a little bit of a break here, Michael. You can go ahead and get some water, go refresh. I see the
What we like to
jacket
hear.
on. I got to get one of those. I got a blue, a black, I got a brown, but I need a gray, boy.
One of every color,
Looking
man.
good,
One of every
man.
color.
Definitely,
Take it, Mitch.
definitely.
I'll see you shortly.
All right, guys, let's go ahead. Let's get into the overall market here. I was taking a look right here at US Steel. The reason why is that they did raise their guidance, but as you guys can see, investors not going too crazy on that guidance. It did jump in the pre-market, but not being able to hold the gains here. Let's take a look at the overall market. The SPY coming on up towards the resistance 369. I actually had that line drawn in the pre-market time, and you can see here we rejected there and started coming right back on down here. So I'm looking for extreme price points to see if we can start seeing some reversal action. But right now, it is not looking good in these stocks right now. So we'll see what happens there. I'm going to go ahead and try to get my comments up here so I can see what you guys are talking. There you go. I'm going to switch it on there for a second. Let me see if I can start seeing the comments come on in. You guys, if you guys got a stock you guys want to check on out, I'll definitely take a look. Throw it up in the chat. But let me tell you a little bit about what's happening today. So really, a lot of this volatility, market volatility that we're seeing is heightened on today because of what? The quad witching. Yes, and look forward towards at the end of the day to see the most fireworks. But right now, we're seeing a lot of chop. And a lot of this refers to the simultaneous expiration of stock index futures, single stock futures, stock options, and stock index options all expiring on the same day. So what does this cause? This causes a lot of traders to either close or roll their position on over. So that's why you're seeing a lot of market volatility on a day like today. But we did see some beaten up names get some relief rally here. I think that's important to kind of keep your eyes out. Now they are starting to give up a little bit of those gains, but let's take a look at some of these names like Apple. Apple bouncing on up there, trying to hold above the 132s, but could not hold at all. It's right back down. It's close to unchanged here, up about 0.31. So what is this showing me? At least some of the higher components are still kind of holding break even or up, even though the SPY is really showing some weakness right now down there towards 363. Of course, we don't want to see it break down yesterday's low here, but we are starting to continue to break that around the 364.26 level. We were looking to see if we would catch some support there. Of course, we've talked about levels like 350 for downside action, but I don't think that's going to happen today. But it definitely is in the realms. What we want to see is it get back above 364 here. But let's take a look at some of these other components. Microsoft also getting a lift, but now it's only up 0.05 here. So it could go into the red there. Amazon's the only one that I see at least holding some of this gain here. You can see the VWAP right underneath it. We'll look for that continuation towards the upside. And it definitely hit some capitulation this morning on the RSI as you saw some bottoming action there. And you can see the reversal happen a little bit there in Amazon. The question is, will it continue? Same thing in Tesla. Tesla's up about a little bit under 1% now, but did get a nice drive out the gates. It was about a 4% move, but then pulled back immediately as some of these beaten down names have been pulling on back. Doesn't look like I'm catching the chat here, so I'm going to go ahead and just go to YouTube so I can see you guys there. I want to go ahead and definitely see if there's any stocks that you guys want to check on out. So let me go ahead and just pull you guys on up here. Just give me one quick second. There you guys. I had you guys up, but just in the background there. All right, there you guys have it. I see Cliff. Cliff did the same thing. Yeah, Cliff probably did the same thing that X did, kind of giving that little up move and then right back down. And so sometimes this can happen often when you're seeing what kind of bear patterns in the pre-market, like we saw here. I'll take a look at, let's do Apple here. So this was in a bear trend. If you take a look at the hourly trend, you're going to see here how we've been sideways here, but also have resistance right up here around the 132. So that's why you're seeing those kind of wicks right above it. So what does it do? It bounces to squeeze out some of those shorts. And as those shorts start covering there around the 132, you get those wicks to start coming on up there, showing you what? Of course, some of that selling pressure that's going on up there. And next thing you know, boom, it's right back down there. And this is why I always talk about closing the candles, because if you look at these candles closed at 132.05, 130.28, and then quickly ran right back through that 132 level. Now you see it back down towards the low. This happens often. What I say is use 15-minute candles to kind of get around this. So you could see here how it came up to the resistance and knocking right back down. Apple almost into the red now. And this is what I was talking about. There was a little bit of a trap right out the gates here. But let's talk about the stocks that have been beaten down the most. Travel stocks like CCL. CCL also making a bounce today, but where did it make the bounce to? Right to resistance, and then knocks right off of that resistance. So you can see here resistance around 915, right? You've gotten some levels of touch in pre-market. You get on down there towards the open, it pops right back up there. But watch how the high is specifically 915 here, showing you that same kind of action. A pop into resistance and then faded away. It's just fading away down there now towards 885. Let's take a look at AAL. Same kind of thing. Pop up to resistance. This one couldn't even go up towards the 1250 resistance. This one only held right above here around the 1230 resistance and just gets knocked right back down. Airbnb probably doing the same thing here. This one jumped a little bit higher, but definitely rejecting to hold anything above the kind of this 95.50 level as you see it come retracing right back down. All right, let me see what's going on in the chat. What are you guys checking on out there? Really weird option pricing. Yes. This is not because you're crashing. This is because of the quad witch. Remember, these guys are determining right now either they close their position or roll their position. So what I think is happening here is you're starting to see some people closing those positions and knocking the market back down. Later on, we'll take a look to see if traders roll into it or kind of close some more positions, but it's going to be some volatility today. You could see chop from the top to the bottom, back to the top, and then right back down to the bottom. So just be careful on out there, team. All right, let me take a look here. Overall market, where we're heading to. We just broke through the lows there. So watch out, guys, as the SPY continues on the way down. What could you be looking to trade? Well, you could be looking to trade some of these names to the downside. Look how Tesla was up about 1%. Now heading almost into the red as we start seeing some other names into the red here. Ford recently released news about their Mach, trying to get they're pretty much telling the dealers that they can't sell it right now because they have a security concern, a safety concern. And so you can see here what happens to this stock. Down 1, right? Up 2, down 2, up 3. We look for the up 3 to reject that resistance, and that starts confirming the bear pattern, coming right back down towards the support, breaking the support, and giving us continuation. How could we measure this move? You can measure this move by measuring what they call the flag. This would be the pole here, and you see 64 cents from the breakdown what I usually do is I do a trend line this way, and where you started breaking down, you can count about 64 cents from that. That's around, let's say, the 629 or 625 level. And if you looked at 60 something cents, you're looking at a move down below 1075s, going in towards the 1060 area. So it could continue to drop there forward. I know it's mentioned in the chat. All right. What else is being mentioned here? You guys talking about Mullen moving on up? Not the biggest move there. So we'll see what happens on Mullen. We've had Mullen on All Access before, and you guys reach on out if you guys want Mullen on again. Let us know. Hit us up with some emails. You can let us know at shows@benzinga.com. We want some Mullen. All right. Let's go ahead. I know Veryu was one that we looked at in pre-market. And this one actually having a good day, cheaper stock here, ripping on up there towards the 13. We'll look to see if it can hold pullbacks now. I'd be looking for 1229, 1230s to hold that pullback, to look for the next drive on up on Veryu, but we'll see if this is able to hold. All right, in a little bit here, we got about 10 minutes. We'll transition on over to the next company. Michael Murray will be back with his great suit, and we'll go ahead and be joined by Ally out. And so one of the things that I've been looking for is how we were going to go ahead and hold up on Amazon, because Amazon has a huge level underneath it. If you take a look here on the hourly chart, guys, we've been trying to hold here right underneath on Amazon. But if it takes that out on the downside, 102, watch out. We could be through 100 on Amazon going into next week. Of course, once we get back into the double digits, I'll be looking for the move next leg down, which is down there actually towards 71. If it does get down there towards then, I will be the long-term investor. But right now, I'm not in Amazon. Just want to go ahead and take a look at that. Donald, you got no volume? I'm sure you guys got volume on me. If not, I think the chat would have gone crazy by now. But let's keep going. What do you got? All right. Is there no BZ live? No, unfortunately, AB will be out today. So what we're going to do is we're going to figure out either we put a good webinar to teach you guys some strategies, or we go ahead and do a replay. That will be playing towards after this show. I think we're wrapping up around 12. But we'll let you guys know. We do have Stock Market Movers. That's going to be at 1 p.m. That's my brand new show. It's been killing it. I want to see you guys there after this. Like always, hit the thumbs on up. We got about 104 likes right now. If you guys appreciate us not only getting into some story stocks today, but also touching some of the market, do me the favor and smash it on up. Let's see if we can get to 150 likes today. Let's go. Smash it. We got over 250 people here. Let's keep it going. All right, so let's go ahead. Any other stocks you guys mentioning in the chat? Hit the mitten. Hit the mitten. That's what I'm talking about, the ghost. All right, look how Baba, as we got in news this morning that potentially the Ant IPO could be coming on back. We talked about that on pre-market prep. Like always, we cover all the macro on pre-market prep. We also talked with CC Lagathor, co-founder at Options AI. So if you missed that show, definitely catch up with that. But right here, China's the People Bank of China is expecting the approval plan in the latest here on the kind of the Ant IPO group. We know that they've been battling to try to come back after regulatory crackdowns in China. They were up today, pretty significant here in the pre-market. Now we've gotten a huge pullback on this, all the way back down here. We'll look to see if the 100 holds today, but definitely you could see the retrace today. Even JD, it's still up on the day, up about 3%, but this gap up is just getting filled right now on the downside. All right, let's go ahead. Let's take a look at oil. Oil is the trend that we're seeing right now, give up right now. Definitely rotation away from the oil names at this moment. Take a look at this sector on energy and look how we've come down in the last, 7 bars here. We've come down 19.7%, showing you the rotation away from the oil names right now. And one trend that I have seen is that when the market comes down the most right now, it's been when the energy trade has come off. And so this doesn't always continue, but right now you could see it on these days when you see energy come down big, those are the days that I've seen the SPY come down the most. And so this is one pattern I'm continuing to watch. If energy just starts coming ripping back up, I'll be looking for some upside continuation. But right now, basic materials and energy just getting destroyed. And this were trades that were pretty hot going into 2022. And now we're starting to really see that turnaround. Names like Coal's down 5.46% in coal. So you could see BTU turning around, AMR, ARCH, a lot of these coal players turning around today. You can see here ARCH breaking through the support. So we're not seeing the same commodities trade as we've been seeing. Energy also turning around. So this could be good signs for inflation overall if we really see this continue. But right now, you can definitely say that, hey, the rotation has come away from the oil names right now, and we're going to look to see if we find a bottom. But look how ExxonMobil, it got above 100, couldn't hold this pullback, and now you're down about 16% on the week. So just be careful about there. Definitely these oil names coming out of favor. It's something to keep on watch out there. Healthcare is bouncing back a little bit today. Let's take a look at some of those bigger what's doing well there. It looks like biotech names are doing well today. So Amgen, AMGN getting a little bounce there, 2% up. Regeneron, REGN getting a little bit of a bounce after they've been beaten down. And so these are beaten down names. So it's kind of what I would call a relief rally. But we'll look to see if these can kind of continue kind of some of this relief rally and continue moving on up. All right, what's distancing is tech stocks aren't rebounding. We're checking the DXY and the TNX. Yeah, tech stocks aren't rebounding right now. What else is being mentioned here? Any stock you guys want to check out? Watch VRV. Don't know this one. Let's take a look here. VRV trying to come on back there through the gap zone. You can see a gap down here from around 1209 up there towards a 1261. So that's where you'll fill the gap. You could find some resistance going into that move. So we'll see if it can get on up there and find some resistance. But right now, this one has been hot today. VERV. All right. What other stocks are being mentioned in the chat? Looks like we got ADAP. All right. There you go. Therapeutic stock getting on up there. Let's take a look here at the hourly really quickly and see what we see here. You can see how you broke out on this hourly kind of trend line here. You definitely can see that as you held here around the 160s today. Once you got above that 164, that's really where you started seeing that drive come from. So around the 164 level is where I would draw some kind of resistance that could become support. You can see we've actually pushed up there through the 177. Next level for me, I'll go ahead and I'll look left to see what I find here. And you can see multiple toppings around this level here. So I would take a look at around 178 to run into resistance to look to see if we get some kind of rebuying to push us through that 180 and resistance getting through. All right, that's probably going to do it for my market action. Remember, guys, today is a quad witch type of day, meaning that you got a lot of contracts expiring on the option side. You're going to see a lot of swings in the pricing of options. So just make sure that you're kind of a more experienced trader on days like today, because these are the days where you can really get just chopped out. So I just want to keep everybody safe. And like always, make your own investment decisions, but know your out plan so you don't get in a world of pain. Thank you, like always, Michael Murray. Hey, that's what it's about, right? We always got to first worry about risk management. Then we worry about the reward.
Risk management is the topic of the day right now with everything going on. It's choppy out there. It's messy.
Yeah. Know what environment you're in. In the tough times, we're worried about risk. And that, by the dip phase that we had in 2020, then we could worry about, 40, 60% returns. But in this moment, it's all about understanding how you can continue into the profits and not fighting the tape or fighting the Fed. Those are also two tips that I'll definitely give out. And that's why the great one, Ned Davis, And if you guys know technical analysis, you've probably heard of Ned Davis. All right, I'll
Heard
send
of
it
him,
back
but
to you.
You're more on the technical analysis side than I am, but appreciate it as always, my man. Thank you.
Always. Let's get back to the stories.
Mitchell Hodge back on stream. We're going to keep it moving into our last interview for All Access. We're going to bring on Ali Parsa. He is the CEO of Babylon Holdings. And get started with our last interview. Let's bring him on. Ali, how are you? Looks like we've got you on mute. Let's give it one second.
No, you got me right.
There we go.
Yeah, so good to see you. Thank you for having me.
Great to see you as well, Ali. Thank you for being here. A lot of exciting stuff to dive into. Before we get to all that, we did a quick intro to Babylon Holdings. Tell us a little bit about the company and what you guys do.
We're a company that was born in the UK where the healthcare system is a lot more frugal and it's a lot more comprehensive. We learned how to look after somebody digitally end to end from cradle to grave. And then we had a lot of insurance companies in the United States telling us, why don't you come to the US? So we did. And in a very short period of time, we built a business in US that is almost $1 billion in revenue, growing super fast. We grew fourfold a year every year in the last few years. And we are continuing to see great market product fit in the United States.
Outstanding. Okay, knowing that, let's talk about artificial intelligence, right? It's a very complex product, not always easy to understand, but you guys do a great job of presenting this to your consumers and investors as a whole so they can understand what you guys do. How do you plan to pitch artificial intelligence to potential customers in ways that they can understand it, right? People that don't know of Babylon yet, don't know what you do. How do you guys present your product and what you do to new customers?
You know, as you quite rightly say, artificial intelligence is a really big word, but you and I use it in everything we do every day. Like every time you use a Google map, every time you use a Google search, you're using artificial intelligence. And so when somebody's ill and they want to know what's wrong with them, they can either Google it or they can expensively talk to a doctor, or our AI will allow them to kind of navigate to see whether they should talk to a doctor or a nurse, or whether they should let it stay for a day or two and it should be okay. In the back end, when our doctors, for instance, write their prescriptions or their notes, the AI is helping them to be faster. When our care assistants are trying to advise you on what to do next, our AI gives them a little bit of help there. So AI is one of those promises that keeps giving, but it just takes time, right? It's your listeners are very familiar with self-driving cars. It's not going to come in one single moment. It comes in a little bit all the time until it learns enough that it clears all the regulatory hurdles. And it's the same going to be about AI in healthcare.
Absolutely. So let's take a broader look at that topic then, right? If you're talking about your plan to scale in relation to the artificial intelligence market and where it's going to grow over the next 10 years, where do you see the role of artificial intelligence being 10 years from now, instead of just where we're at and how you're leveraging it and how you're presenting it to your customers? How are you going to scale along with the AI market as we move ahead into the future?
So where I was born, they would say, if you want God to laugh, you give him your 2-year plan. And I think that trying to predict where AI will be in 10 years time, it's a dangerous game. But I think when you bring a series of technological developments that are happening together with what is happening in the field of AI, then this could be mind-boggling. Just think about quantum computing, right? Unstable now, the problems are not solved, but let's imagine it did get solved in 5 to 10 years time. That's a machine that even its today version is 100 million fold faster than the fastest supercomputers we have. I mean, the ability of running AI on those machines versus the existing machines that we have now is truly exciting. I think that one of these two will come first, either general artificial intelligence or quantum computing or something similar to that. Whichever it does, you kind of get it to solve the problem of the other, to bring that one into life too. I mean, it's a fascinating area, but 10 years is a long way away. I think there is a lot we could do today to make healthcare a lot more efficient, cost-effective, cheaper, more affordable, more accessible for all, with even the tools we have today.
Absolutely. So, and then let's take an expanded look on that too, right? If you look at the future and you're talking about 10 years from now, again, I like your quote about if you want God to laugh, give him your 2-year plan, because none of us know what's coming next, right? And obviously, just the developments we've had in the last few years, we've grown so much as a nation, as a culture, with our technology and everything else. But your plans to scale outside of just primary care, what else do you plan to use your technology for? Is there any other, channels or ways that you can leverage the technology that you have?
So what we learned is that this thing you and I call healthcare, it really isn't healthcare. It's a sick care industry. It waits until you get sick, then it fixes you. When was the last time you did that with your car? When I was a younger person, we used to drive our cars until it broke down. We took it to a garage, they fixed it, and then we drove it down until it broke down today we've buried so much sensors in our cars that we kind of know when things going wrong ahead of time, so we can intervene early to prevent the crisis and the emergencies. Why don't we do that with our human body? And that's what we're trying to do in Babylon. And because we've been very successful with it, so we published a peer-reviewed paper that showed that in Europe, with the National Health Service, which is 3 times more frugal per person per capita on the money it spends on people than we are in the United States, we could save for them up to 35% of all the costs. So in the United States, we go to the insurers and we say, you know what your average medical cost per person is going to be. We take that, but instead of waiting for that person to have crisis, emergencies, and only pay for those disasters, we try to look after them really well, collect their information early, try to avoid those crises and emergencies. I mean, looking at you, I can see you look after yourself really well. If you do that with a lot of people, that would really save time and effort.
Absolutely. Okay, so let's talk a little bit about the market, right? We've talked about this with several other participants this morning. What you guys are working on and what you're doing, I'm sure it's been affected, by the markets and the times that we're in just as much as anybody else. But how do you guys plan to persevere through everything that's happened so far with the biotech market, with everything dipping and dropping? What are your plans to overcome adversity and keep doing what you're doing?
So we had a horrid time at the market. We unfortunately almost, if you wish, chose to come public as a SPAC because the rate at which we were growing, 400% a year, to using an ordinary IPO, and we had a lot of banks lined up to take us public normally. Well, it didn't make sense because we had to use our backward numbers rather than share our forward. Unfortunately, as you know better than I do, a lot of the SPACs just didn't meet their numbers. We beat our numbers, our projected numbers so far significantly. Like last year, we beat. This year, we were expected to do $750 million of revenue. We're now expected to do more than $1 billion in revenue. But we kind of got caught with that whole thing. So by the time we came to the market and the market had collapsed, we didn't really have as many US institutional buyers on our side. So we're trying to fix that now. So we had a horrible time with the market, but we have enough money for the time being. The revenue is doing really well. The business is growing. Our customers are coming to us. And I think, you quote the good and the great. And Benjamin Graham used to say that the stock markets in the short run are always a voting machine, but in the long run, they're a weighing machine. And companies that are just adding up to the weight, they will eventually get rewarded. You remember, I used to be an investment banker with Goldman Sachs in 2001. And at the time, I remember Amazon losing 90% market share. And everybody thought that's the end of the internet, that's the end of the Amazon. And Amazon just kept putting the weight on. And the business just got rewarded really well eventually. Businesses at the end work on fundamentals, not on market sentiments. In the short run, though, you have to be very careful about market. You're absolutely right.
Awesome. Well, let's take a little bit of a deeper dive into that and talk about a development for you guys specifically coming up. It's very exciting. You're set to join the Russell 3000 index on the 27th of this month, as long as that's correct. Why is this so impactful? Why are you guys so excited about it? And what does this mean for the company going forward?
So, we're excited about it just because it'll put us onto a US index, right? We came into the US recently. As I said, the SPAC thing wasn't a great way of getting in at the time because the whole SPAC thing failed. But now it'll start getting institutions to invest in Babylon. And as they do, and the more institutional investors we see, the more excited they are about the story, right? There are not that many people who can deliver an end-to-end digital care model that can seamlessly pass you on to your primary care physician, first virtually, and then physically when necessary, and then refer you to a hospital, bring you back, make you well at home, and then take the risk away from the insurers by managing this end to end. So the industry really likes this story. They love the application and the technology. So the more we can show it off, the more we can have people to pay attention to it, the more I'm sure that we'll get through. It just puts a bit of the stage light on us, and the more light we get, the better we perform.
For sure. In talking about performing and getting more attention and light on you guys and what you're doing, I was reading something from May about the New Health Physicians Plus relationship that you guys have. You're caring for more than 19,000 Medicare beneficiaries through that. Talk a little bit about that relationship and why that expanded reach and who you're able to get in front of is so important in this relationship.
So this is one of that relationship is very important to us because there are a great group of physicians who worked with us, who saw what we have to offer, and took our technology and our partnership and are offering it to their members. But in partnership with them, we can now offer a full range of Medicare services to their patients. But you must remember, in January 2020, we had our revenue in the United States was $0. We had zero life under management. By October 2020, we got our first set of lives, about 17,000 people out of management. Today, we have around 300,000 lives under management. These are people for whom we get either the entirety or just the professional section of their medical expenses, and we manage it. That kind of growth, I can't think of any other company in the United States that grew like that. And it grows through partnership, through physicians trusting you and what you're doing. And we hope to bring more of that on board soon.
Fantastic. Okay, a couple of other things to dive into as well, but I think one of the most important things that, and we've already talked about the artificial intelligence and how it's difficult to present to people, but it's kind of a buzzword, right, throughout the industry. What do you think some of the misunderstandings or something that you think people don't understand enough about artificial intelligence would be? Could you dive into that a little bit?
Yes, for sure. I think that AI, like any other significant technology, I think is underestimated in the short run. It's overestimated in one way in the short run. We all think it's going to do a lot more than it did. But over long run, it's absolutely underestimated. As I said, when you put edge computing, quantum computing, AR and VR capabilities, robotics, all of those things that we are recreating in the technology world. And then think of the software layer of artificial intelligence we can put on top of that. And what that can do, immerging the virtual and the physical together, and the level of intelligence it can bring. And if quantum computing comes live, a machine that our AI algorithms can sit on, that is 100 million-fold faster than the fastest computers that anybody has today, I mean, this is going to be incredibly powerful. A lot of fantastic people are doing great work on that. I think AI is going to be one of those technologies that will have an effect in the way our civilization will develop in a way that not that many other technologies have done.
Absolutely. So let's talk about the revenue implications and the potential when you're talking about how much this is going to grow, right? Your Q1 earnings report, if we dive into that a little bit, grew 3.5 times year over year to $266 million. What were the growth drivers that led to that? Why do you guys think you had such a jump in revenue year over year?
So our biggest jump in revenue was the fact that more and more insurers trusted the lives of their customers to us. If you're an insurer, and not all, but often they don't have enough tools in their arsenal to be able to really help you to stay healthy and to avoid your crises and emergencies. And one of the things that we bring to them is one of the very few companies who could do so at scale. I mean, yes, there are other companies that they have a clinic, and if you're lucky enough to live around their clinic, they just you can be looked after by them. And most of those companies are looking at Medicare because the dollar signs are bigger in there. But we're agnostic. We can look after you if you're a commercial member, if you are a Medicaid member, if you're a Medicare member, and we could grow at massive speeds. One insurer asked us to take on 17,000 people in 60 out of 62 counties in the state of New York. And from the day we signed the contract to the day we started serving those people was 7 weeks. Can you imagine any other company being able to do that? I mean, the difference really is between Amazon serving you across New York from a warehouse and virtually and everything else versus setting up 7-Elevens everywhere, right? That model of physical, clinical, periodic, episodic, wait until you get sick to see a doctor, it's an old model of healthcare that eventually will be replaced by a continuous digital, always on, in your mobile, always available to you, monitoring you, collecting your data, warning you, predicting to prevent your crises and emergencies. And that's what we are building. And that's why the revenue is growing so fast, because there are not that many other people who could do what we do for our clients.
Got it. In taking that a step further with revenue too, you increased your 2022 guidance to 1 billion or greater and updated the adjusted EBITDA guidance. Talk a little bit about that, right? Obviously, if you guys are looking at this increased guidance for 2022, how much greater do you think you can grow the year beyond? And also, do you think there are any inhibitors that could slow you guys down from hitting this increased guidance?
Look, our growth has been, as I said, our growth has been almost 400%. We grew fourfold a year, every year, almost for the last 3 to 4 years, right? And we could continue growing at very fast speed. As you said, our first quarter revenue multiplied by 4 will still be a larger number than $1 billion. To put this in perspective, our first quarter revenue of this year, 266 million, was 60 million shy of all of our last year's revenue. So the numbers are doing really well. The challenge, of course, is that it costs to grow, because in the first year when we take on new members, we have to engage them, we have to health assess them, we have to put them onto our programs. And with the financial market being what it is, some of the engine of that fast growth has been taken away from companies like us. So we need to grow a little bit more modestly, not a lot, but a little bit more modestly, in order to make sure that the cash that we have goes a long way until these markets come back and the engines for growth come back again.
Absolutely. That's perfect. Okay, and then one more question along that line of revenue, right? If you're looking at this increased guidance and everything else we just talked about, the year-over-year growth especially, what about profitability, right? Do you expect that sometime in the next year? When do we expect to hit that level of profitability considering this increased revenue guidance?
So I think profitability is really important, in the same way that I never was a big believer in growth at any cost. When the market was running there 2 to 3 years ago, it was all about growth. You could lose money and grow. Unit cost profitability is super important to us and has always been. And almost in most of our contracts, we either reach unit cost profitability in the first year, if not certainly in the second year. And we just published some of our profitability growth. I mean, look at this. In our very first year, in the contracts that we had, in Medicaid, that are some of the toughest contracts to have in the United States, and most people have lost money in, we made a 2% gross margin. In Medicare, in our longest lasting contracts for a full year, we made 14% margins. And in our commercial deals, we published a 19.6% gross margin. This is as good as anybody almost in the market, and certainly as good as anybody in the first year. We are, look at who my leadership team is, right? P.H. Ferrand, Paul-Henri Ferrand, who was the president of Google's cloud businesses. Steve Davis, who was the vice president, SVP, senior vice president of data and AI out of Expedia, one of the largest data platforms in the world. I can go on and on about the leadership that we put together to solve one of the biggest problems in healthcare. But to do that, it will take time, but somebody will make one of the most valuable companies in healthcare, because healthcare is one of the most largest sectors of the economy. And it's this time that we turn this reactive, sick care, crisis-ridden model into a proactive, true healthcare, always-on service that is there to keep you at the best of your health.
Absolutely. Ali Parsa, it's been an absolute pleasure having you on All Access. A lot of exciting things to look forward to, and congratulations on all of the progress you guys have made. It's going to be an exciting 2022.
Thank you. So good talking to you.
Ali Parsa, CEO of Babylon Holdings. Great interview there. That's going to wrap us on All Access. There's one thing that we have to make sure we bring up. Our sponsor for All Access is Ticker. They provide stock perks and rewards to individual shareholders for the companies that you invest in. We have a promo video to play for them. But I got to say, I love the Ticker team. We know them personally. We have them over to our office all the time. Great people, amazing customer support, more amazing perks too. Check out the video and get involved with Ticker in the link in our description.
What is Ticker? That's right, Ticker with 2 I's, just like you. Because it's for you, for investing, for stock perks, for connecting you to public companies who reward you as a shareholder, as a brand lover. That's why people can't stop tickering. Ticker, where investors discover shareholder perks and consumers become investors in the brands they love. Ticker. Start tickering today.
Team that puts this together. Aaron Thomas is hustling this week. He is on his own. Producer Rohan's out of office, so Aaron is holding down the fort all by himself. Always multitasking, always making it happen. But again, we want to thank all of the companies presenting today. Amazing stuff. Obviously, exciting things coming ahead for all of them in 2022. And of course, as always, I want to say thank you to everybody for tuning in to Benzinga All Access.